So I'm just going to turn the head just around a little bit to put it on a loosening position, a slackening position to pick it up. Now first off we do the superficial section here, and we pick up like this there.
Oh.
Okay. So it's okay to work from here like this, but don't do this one.
This is the carotid artery.
Okay, so we pick up here like this. Okay, pull out.
A little bit into the jaw.
The jaw again. Okay, coming up a little bit further.
Yeah, almost into my teeth.
Yeah, which does actually refer to there. So we have quite a few referral pains to Donna to the jaw. Still
Easing down.
easing, starting to ease now. So once it eases off and it's gone, you can come off. Okay,
Nearly.
nearly. Oh, slippery. Sometimes it just slips away from your finger.
Especially if it's tight.
If they're taut. Some people are very hard to pick this one up, so you need to put it into a slackening
gone.
position. Gone. Okay, as soon as it's gone, come off. Okay, moving up a little bit further. Might have to dig down and pick it up like this. Okay, we're on the next point.
That's okay.
No trouble there.
Oh yeah. Go into the jaw again.
Again, the jaw. So, talking too much.
Easing down.
Easing off now.
Gone.
Gone. So when they work like that is good. Now these points here that we're working at are latent trigger points because she's not getting the referral pain before she comes in here, but I'm producing that referral pattern, so we would call that a latent trigger point. If Donna had come in, she says, I'm getting pain here already now, then I would call that an active trigger point. So a little bit harder to deal with too sometimes. Okay, moving up a little bit. You need to be careful when you're working this one, Jagadiri.
That's okay.
No problem.
Just local.
Just local. Local, not the problem. We're really looking for a referral pattern. Sometimes when I work with people and I'm working all the back, I compress all the muscle around the region and ask them to say, can you tell me if any of these points refer a pattern to the back of the neck or into the head? And if they do, they might say, oh yes, I feel this one. Then I'll focus on that one and treat that as a trigger point. But if there's no referral from anywhere, it might be just a tender point or an acupuncture point, acupressure point, so I'll just treat it like that and just do massage. Okay, just picking this one up. But
A little bit into sinus.
these ones are good for releasing pressure on the face, eyes, sinuses sometimes, jaw, which Donna gets quite a bit of jaw, TMJ.
And it's not easing yet.
Not easing, so we'll stay there for a little bit.
Yeah, it's starting to ease.
Starting to ease off now. Okay. Just come off that for the sake of brevity. I'm just going to go right up onto the attachment. Sometimes this one may refer even into the ear. It's very, very high.
Closer to the sternal incision.
Yeah, yeah. Very close.
No referral.
No
Just
referral,
spot.
just local tendon. Okay, so that's fine. Okay, we now always we do both sides. Okay, so we'll come across the other side and see what's happening here. So just picking that up, shuffling around, lifting, relatively easy to pick up. Okay, this one would probably be a good one for your soccer players because all the headers they do, and they have to use this muscle, and also the deep ones in there, but they're a bit tricky to get to. We won't show you those today.
No referral.
No referral, so no need to stay there. We really just need to look for triggers. Okay, moving up one step.
Yeah, into the jaw.
Jaw again.
And
Sinuses again.
Sinus.
Level pain,
Yeah, it's gone, pretty well gone already.
eased off. Okay, good. Sometimes they just go quickly like that, which is good. It means you don't have to stay there too long.
Just on the spot.
On the spot, local, so no referring.
No referral.
Okay, so no referral, we just move on.
No referral.
No referral. Not as much on the right side as one is on the left side.
No referral. Oh yeah, maybe a little bit in the sinus.
Sometimes they might just ease into it and straight away there was no referral, but then it started to come in a little bit later on. So sinus is here.
Yeah. Not pain, just depression.
Just pressure. Okay, we'll come
Sensation.
on. Just one more, higher up.
Yeah, it's okay, just on the spot.
Just on the spot, so we don't need to work. We only need to treat it as a trigger if it refers pain or refers sensation. Okay, they're the two superficial muscles here. Now, because the sternomastoid also has a deeper division of it, so we need to get in a little bit deeper there. So what I normally do is pick up the first one, then go right down under here like this, and if I flick across that, you'll see it goes 1, 2. Yeah. See that one underneath? Yeah.
Yeah.
There's the first one down there. 1. See that little flick across there?
So you release the first one?
I've done the first one. We've done the
Superficial.
superficial one. That's the one that we can see here easier. But the other one lies under that one there. So that's the one that I need to, and it's a bit harder to get to. Some people it's really hard. And there it is. There. I'll go back and pick that up. Okay. Yeah, that's fine if there's any referral.
Yeah, that's
This can be a bit more intense.
going into the ear.
Here. Got a few.
It's okay now though.
Eased off. Good. Okay, so we move up just one more.
Oh, definitely more sensitive.
More sensitive, the deeper one.
Jaw.
Jaw again. Might have to get you a new jaw. Still.
Just about gone.
You'll find sometimes when people do have an amount of these trigger points, when you're releasing the trigger points, remember we were saying that they do get accumulation of lactic acid, hyaluronic acid, and sometimes serotonin, which is quite a strong. Now, when they're finished here, the other thing, if they have been having an amount of trigger points, they may have trouble sleeping, because these things can wake you or keep you awake. So when I've had some people that have actually had to get their partner to come and pick them up, because when you release these trigger points, you release all that toxin back into the bloodstream, and they'd be so they might get to the traffic lights and go to sleep. We don't really want that to happen. So make sure that they drink plenty of air, a lot of water after, particularly. Flush out the system, because that does get into the bloodstream. It will and they will definitely that night have a good sleep. Tedur, good, eh? See, I do know lots of words. I just can't talk. How are we here?
Just local.
Local, no problem. We don't worry about the local because we just really want to release the triggers. We just have to be a bit careful with this one. Put it into a position like that makes it a little bit more slackened.
Jaw.
Jaw again, always to the jaw. So there could well be a TMJ, temporomandibular joint problem, which sometimes used to grind teeth. People grinding their teeth could possibly come from here. Still?
No, gone.
Gone, good. At least they're releasing quickly, so that's good. So they haven't become active. If they're active, they may take longer to release.
Temple.
Temple.
And
here,
forehead.
and around here. So we're getting that up around this point here.
It's easing down.
Easing off, which is good. Good.
I can feel it in my eye as well a bit.
Eyes, yeah. Yeah, Yes, eyes sometimes after a release it tends to, ooh, I can see clearly now.
Yeah, it's okay.
Good. Last one. Quite high, a little bit harder to get to. Once you get familiar with working with the body, you don't mind going, I can go deep into the abdominal and work in there because I'm used to working there. Sometimes when you first start, it takes a little bit getting used to working with people like this too.
It's okay.
Good. Okay, so that's had a few in that side. Now again, we need to look at the other side. Again, we're going for the deeper one here. So find the first one, there it is there, and just go a little bit wider and deeper, and I'll flick across there. There it is there. Sometimes when you flick across, it's like, oh, very sensitive. Okay? And you'll be able to feel it under your thumbs, between finger and thumb, like.
So this is a really good one to practice on yourself.
Yeah, you can do this sometimes yourself. Sometimes if I'm going to work, or if I have to in the car or sitting at the traffic lights doing some massage here, so I can open my eyes. Okay. How's the deep one?
Yeah. Yeah, coming right up through the side again of the jaw.
Right up the side of the jaw. Intensity?
Yeah, not so bad.
That's so bad. Okay, let's move on. Here again. So we've done a fair bit on these. How's this one? Sometimes you'll actually feel them under your thing and you'll think, oh, a little nodule, little.
Yeah, it's mainly local.
Local,
Yeah.
no problem. Moving up, we'll do one more.
Yeah, to the jaw.
Jaw again. This side?
Yeah, and going
Around the jaw area.
through the front.
Probably with this much in the jaw too, I'd probably do some massage.
Massages will be
Yeah.
probably got trigger points too.
Yeah. Referring still?
Yeah, actually now it's started
Going
going
right
up.
Right up around the head.
It's starting to ease down now.
Easing off. These ones have been easing off quite well. You might get some clients or some patients that the triggers don't tend to ease off so quickly.
This
It means
one's
you might
slow.
have ease off.
This one's taking a while to
This
go.
one's taking a little bit longer this time.
It's eased from here and I'll just feel it
Then around the
through
jaw
the jaw.
again. There might be a restriction in the jaw opening as well. Sometimes, how you doing?
Yeah.
You can actually test somebody's, or get them to test it. You should be able to get 3 knuckles not in there for a correct range of movement in your jaw. 3 knuckles like that, you should be able to get in. We had one girl in our class some time back, because it was an Italian girl. She could
Oh, hand.
but she could talk a lot too. How high end in there. Okay, now we've found that there has been, I would probably do a little bit of massage. I would probably use Selena's magnesium oil and massage in the jaw, because you've got a lot of bone structure around here as well, and the masseter's down in this area through there, so I would do some massage, probably up underneath the jaw line through here as well, just general massage through there, because she had been getting a lot into there. I would certainly get her to check the range of movement. She should be able to get
Yeah,
3
it's
knuckles,
okay.
and she probably not be able to do that.
No, I can.
You can?
Yeah.
Oh, good. It used to be that. Okay, so now we'll do a PNF or an isometric. Now there's a couple of ways that we can do this one. We'll do the simple one to start with. I'll get Donna to turn her head one way. Either way, we're going to turn. Put your hand underneath the head so that you're supporting. My other hand is around the ear like this. We don't want to cover the ear like that, or stick your finger down there like that and hold it on. So we're going to hold here. I'm going to get Donna to rotate Kanan against my resistance. So she's turning her head to the right against my resistance. Okay. And again, approximately 7 to 10 seconds was really good. And she relaxes, little breath, and turn to the left a little bit further. Good, see how that one turned the head around? Okay, now turn back against me again. And relax. And turn to the left a little bit more. Okay, now relax. I'm going to turn the head. So when we've had the client around here, I always move the head around here. This kepala here weigh about 10 pounds. Not sure how many. Now we'll get you to turn to the right. So after you've done all this work here, you don't want them to turn their head around because they might undo what you've done. So I always try to turn the head around
And
myself.
that's restricted because of my lower scapula.
Okay, now I'm going to get you to turn to the left against my resistance. So again, we do this about 2 to 3 times depending on how much problem that they have in there. And relax, little breath, turn to the right again. Okay, so her range of movement is quite good. Okay, turn to the left again against resistance, so she's rotating the head like this against my resistance. So this is a pretty easy one to do. Relax to the right. Now the other technique I'm going to do, I'm just going to get to shuffle forward. I'm going to roll that up here, put that underneath there like that. Always hold the head. Don't let it go, otherwise. Yes. Okay. Yeah, exactly. Yeah. So I'll get you to turn to the right, maybe.
To the right. That's to the left.
Try the left. Yes, that's all right. Testing.
Yeah, he's awake and he's not.
So he's awake. Yeah, you're awake. I'm going to drop the head down a little bit like this as far as I can, comfortably. Okay, always make sure that you're comfortable with him. Jagadiri, take care. Supporting here, now Donna's going to flex her head forward. So flex up against me. See the muscle now working? The right side is working because she's going into flexion, not rotation. And relax. This is a good way of doing it. This is a good way because you're working here and it gets a good stretch. See how I'm stretching that there? You just have to take a lot of care here, Jagadiri. And push up again. And not too strong, just comfortable. All you need to do is contract the muscle nice and easy. And relax. And she stretches. Now lifting the head, turning around slowly, turn to the right, drop the head back. Support about halfway and just lift up against my resistance again. Okay, see how the muscles are working? You can see the 2 divisions here now. And relax. Let the head drop down by itself as comfortable as you can. If they start to fidget and it's not comfortable, don't go too far. Lift up against me again. And relax. And stretch. Lifting the head, supporting underneath the occipital, dropping it down there. And I would finish off with a nice little massage, but we won't worry about that. We'll do that later on when we're doing that. And just ease off, just a nice little movement to ease it off. Okay. Voila. Usually after you've been working there, if they're going to get up, get them to get up slowly because they may feel a little bit